Today on the show, the benefits of a comprehensive breast cancer facility. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This is the fourth episode of our international series, where we spotlight the pioneering clinicians who participated in the first global panel discussion at the 41st National Oncology Conference hosted by ACCC. Today we speak with Dr. Maged Moaz, who joins us from the Baheya Research Center in Egypt.
I think the biggest challenge that we are facing in Egypt is that near half of patients come to our center in an advanced stage. According to our cancer registry statistics, around 47% of patients come in stage 3 and stage 4. And according to a recent meta-analysis study, they found that 45% of patients come in stage 3 and 55% of patients come in stage 2, in T2 and T3, and more than 70% of patients showed a positive lymph node. And why the incidence rate of breast cancer in Egypt is below the global average, which is 48.8 per 100,000 population, but the mortality rate is alarmingly high as it reaches 20.4 per 100,000 population, and this figure is pretty much higher than the average in other developed countries like USA. A recent study that investigate why patients have delayed diagnosis and coming in advanced stage, they found that there is a gap of 7 months between the onset of symptoms and the starting of treatment. And more than 60% of this delay can be attributed to patients themselves due to low awareness and education among patients and among population in general about breast cancer symptoms, early detection, how they do self-breast examination. Also, there is another important factor that affecting this delay is the Egyptian health system itself. It is fragmented with a mixture of public, private, governmental health providers, which leaves the patients confused where she should go to ask for medical advice. Also, there is a lack in a well-structured financial system, which pushes patients toward more poverty and put a huge burden on poorer people rather than rich or normal people.
How has your facility responded to these challenges?
Baheya vision was to create an integrated healthcare center that is specialized in providing services to all breast cancer patients, all in one location, or are free of charge. These services including screening services, medical care, psychosocial support, nutritional counseling, and rehabilitation services. And all these services are delivered in a high standard quality as Baheya has obtained JCI accreditation in 2021. So Baheya started as a single healthcare facility in 2015, but in March 2023, we have expanded to open our second branch, Baheya Zayed Hospital, which spans over than 35,000 square meters and is designed to serve more than 500,000 women annually. In parallel to this, Baheya has placed a strong emphasis on building a robust outreach program to reach women all over Egypt to enhance their awareness and education about breast cancer and to catch cases in early stages. And this is, in my opinion, this is what distinguishes us as a unique breast cancer center in Middle East and Africa, with our survival rates aligned with the international survival rates, as we reaches in our center survival rates by 91.5% at 3 years and 86.9% at 5-year survival.
How might ACCC help Egyptian cancer centers?
In my opinion, ACCCs can help healthcare providers in oncology field in Egypt by offering specialized training, workshops, and programs to enhance our skills in cancer care management and to keep them updated to the latest treatments and innovations. Also, we can collaborate in the research field by conducting joint research studies or initiatives. This will help us to exchange data, resources, and expertise. Additionally, ACCCs can help us by their long experience in delivering cancer care services to be a guide for Egyptian institutions to create their own efficient workflows in the field of screening sources, multidisciplinary cancer care, and patient support systems.
Thank you, Dr. Moaz. Our next episode in this series comes to you from Sweden. Make sure to follow so you don't miss it. Thank you for listening. Until next time, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.